It's very rare that I feel the need to address a comment with a video response. However, I feel like this is a comment that needs a reply that is slightly more nuanced and also gives a broader perspective on this topic. So, Susan says, as women, we are always told that stress and anxiety are the reasons for our illnesses. You must know this, yet it is hardly ever the case. There are medical reasons why there is a ringing in the ear. I fully agree with you on the last sentence because yes, there is always a medical reason why there is a ringing in the ear. And those medical reasons might sometimes be chronic stress or anxiety or, as I mentioned in my previous video, depression. Now, if a doctor mentions to you that stress and anxiety might be a cause of a physical ailment that you're experiencing, it's not them trying to dismiss your suffering. It's actually them affirming to you that you are really going through a very intense reaction of your physical health due to something that has been going on in your mind or in your brain. And that field of study is called psychosomatics or neurosomatics. Psycho-neuro translates to the mind or the brain. Somatics is the physical body, physical health. These are not two separate entities. This is one system that continuously communicates with each other to keep all systems ago. Now, let me explain with specific details. Chronic stress has a direct impact on the autonomic nervous system, meaning that if we experience stress over a long period of time, it can affect the autonomic nervous system by causing inflammation and even damaging the physical nerves in your body. And that can lead to a hyperexcitability or a hypersensitivity of nerves, then misfiring signals to the brain or causing all sorts of symptoms such as chronic pain or tinnitus. And there's studies that have proven that at least 40% of tinnitus patients have some form of chronic stress in their life that has been causing damage to their nervous system, perpetuating and even causing tinnitus. Even me in my practice that I've been running for 5 years, I see this on a daily basis. A third of my clients has chronic stress in their life that is making their tinnitus symptoms considerably worse. On the other hand, we have mental health issues such as depression or anxiety, which affect the human system in a slightly different way. So conditions such as depression or anxiety activate the HPA axis in the brain, which is the hypothalamic pituitary adrenal axis, and that is responsible for the signaling of the release of hormones such as cortisol in your body, which is the stress hormone. And a prolonged activation of this system can cause a whole range of issues such as insulin resistance, chronic inflammation, gut microbiome disruption, gut permeability, so leaky gut, and so many more issues that we are seeing that are on the rise more and more in this day and age. With all of that being said, I would love for people to understand the intricacy of the complexity of our physical health a little bit more by also understanding that when a doctor tells you that it might be stress, it might be anxiety, it might be depression, they're not trying to tell you it's just in your head. They're not trying to tell you that your suffering is invalid. They are actually trying to get to the root cause of what is going on, to look at your health in a more holistic and functional manner, to actually get to the bottom of what's going on and giving you the appropriate care that you deserve.